Now in this video of medical education series, I would like to tell you how to make a good multiple choice question. So MCQ is also called item. Now this video is important for those who are studying or teaching medical education series, as well as for those supervisors or who want to become supervisors. So it's a very high yield video. So the MCQ is also called item. So you should write like item number 1, then you have to state your discipline. Like I am an ophthalmologist, so I would like to write ophthalmology. Then you have to write the topic, in which topic you have constructed this MCQ or taken this MCQ. So I have taken this MCQ from glaucoma. Then comes the theme. Now theme is very important. Theme means the symptom of a patient, like decrease of vision. You can add pain, or you can just write in theme decrease of vision, or pain in the eye, or itching, or deviation of the eye. So any symptom is your theme in your specialty. Then the sub theme. Now sub theme means that what you want to check. You want to check the diagnosis of the student, you want to ask about a specific investigation, any specific treatment option or complication of that. And then comes the stem. Now stem is a scenario that 45 years old woman presented in eye emergency late night with complaint of painful decrease of vision in the right eye for last 3 hours. Now it is an acute case. According to her, she was all right till evening, and then she developed a painful decrease of vision while reading book when the light becomes dim, and it was associated with an episode of vomiting and nausea. On examination, her eye is red, congested, and photophobic, and vision in right eye is counting finger. There is a severe corneal edema, mid-dilated non-reactive pupil, and shallow anterior chamber. So that's a scenario. It has told you everything about that patient. Now lead in. Lead in is again the sub theme. What is the most likely diagnosis? Now in a medical education, you should give a very clear cut scenario, and you should ask a very clear cut thing. Like these things are not allowed to ask in exam nowadays, that what is the correct statement except, or all of the following are incorrect except. So what is the most likely diagnosis? Then you give options like A, B, C, D, E, and the options should be given in alphabetical order. Like A option is from acute congestive glaucoma, then after A comes H, herpetic uveitis, then comes N, neovascular glaucoma, then O, ocular hypertension, then P, Poisson-Schwarz syndrome. So you should also remember that you should state the options in alphabetical order, and then you should give the key. Like in this statement, A is correct, so you just write A, not the whole acute congestive glaucoma, and then you have to present the reference from where you have made this MCQ. So like I have made this from Kansky Clinical Ophthalmology. You should also mention the edition, the chapter, and even the page number. Then you should tell how much difficult this question was, whether it was easy, moderately difficult, or very difficult. So it was a moderately difficult question. And then the last is whether it is a supplementary knowledge, whether it is important to know or essential to know. So this condition is essential to know, so it will have a high rating. Thank you very much.